couple of years ago, when I was attending the TED conference in Long Beach, I met Harriet. Now, we'd actually met online before, not the way you're thinking. We were actually introduced because we both knew Linda Avey, one of the founders of the first online personal genomic companies. And because we shared our genetic information with Linda, she could see that Harriet and I shared a very rare type of mitochondrial DNA, haplotype K1A1B1A, which meant that we were distantly related. We actually shared the same genealogy with Ozzy the Iceman, so Ozzy, Harriet, and me. And being the current day, of course, we started our own Facebook group. You're all welcome to join. And when I met Harriet in person the next year at the TED conference, she'd gone online and ordered our own Happy Haplotype t-shirts. Now, why am I telling you this story, and what does this have to do with the future of health? Well, the way I met Harriet is actually an example of how leveraging cross-disciplinary, exponentially growing technologies is affecting our future of health and wellness, from low-cost gene analysis to the ability to do powerful bioinformatics to the connection of the internet and social networking. What I'd like to talk about today is understanding these exponential technologies. We often think linearly, but if you think about it, if you have a lily pad and it just divided every single day, 2, 4, 8, 16, well, have 15 days, you have 32,000. What do you think you have in a month? We're at 1 billion. So if we start to think exponentially, we can see how this is starting to affect all the technologies around us. And many of these technologies, speaking as a physician and innovator, we can really start to leverage to impact the future of our own health and of healthcare, and to address many of the major challenges that we have in healthcare today, ranging from the really exponential costs to the aging population, the way we really don't use information very well today, the fragmentation of care, and often the very difficult course of adoption of innovation. And one of the major things we can do, we've talked a bit about here today, is moving the curve to the left. We spend most of our money on the last 20% of life. What if we could spend and incentivize physicians in the healthcare system and our own self to move the curve to the left and improve our health, leveraging technology as well? Now, my favorite technology, example of exponential technology, we all have in our pocket. So if you just think about it, these are really dramatically improving. I mean, this is the iPhone 4. Imagine what the iPhone 8 will be able to do. Now, I've gained some insight into this. I've been the track chair for the medicine portion of a new institution called Singularity University, based in Silicon Valley, and we bring together each summer about 100 very talented students from around the world, and we look at these exponential technologies from medicine, biotech, artificial intelligence, robotics, nanotechnology, space, and address how can we cross-train and leverage these to impact major unmet goals. We also have 7-day executive programs, and coming up next month is actually Future Med, a program to help cross-train and leverage technologies into medicine.